Dr. Hunter, first of all, my question to you is, you were approached by several people after the presentation. What were their questions? What were their messages to you?
Well, I was talking about these special groups where sexual abuse takes place, and the reason for that is because these are topics that haven't gotten a lot of attention. And so basically what they were saying is, I know about this, but how come people don't want to talk about it? And the price that people pay for it being secret and taboo to talk about.
And also, you had mentioned at the very end of the presentation how you were able to be in therapy with somebody who never did tell you what the situation is. If you could recap that for me briefly, I just thought that was so powerful.
Well, this man came and said that he had a history of trauma, but he was too ashamed to tell me the actual event, and that I worked with him on the shame reduction about it and self-forgiveness and forgiveness of others, and he never did tell me what the event was. And at the last session, I asked him, and he said, well, it's really none of your business, which was a powerful lesson for me. Like,
yes.
Well, really, I don't need to know the details. It's the effect that it had on the person, and it's the healing relationship that matters, not the details.
And the healing that takes place regardless of what the event is.
Yeah, well, the whole idea of it's not the details of the event, it's the meaning that people assign it. And what he thought was no one could accept me, and he found out that somebody could accept him.
Absolutely. Talk to me a little bit. You use the words "of course." I had never heard that used in the way in which you apparently use it in therapy. Talk to me a little bit more, or a lot more, about the "of course" theory.
Well, the idea is that people do whatever they need to do to survive, and that then after the fact they have this sense of, well, I should have done more, and I could have done more, and they maybe could have done more, but would it have changed the outcome? It might have made it worse. And so to kind of give people permission, that's what those two words do. So, well, of course you kept it to yourself, because if you had told somebody, you would have gotten in more trouble. Or, of course you didn't resist because the person had a weapon. Or, of course you waited until you were in therapy to tell somebody because you thought no one would believe you.
Of course you protected yourself.
Yes, exactly, yes. That this was the right thing to do, and no more can be expected of you, and stop being hard on yourself about it.
Absolutely. Tell me a little bit about how you got interested in the subject or subjects of male sexual abuse survival.
Well, I was working in substance abuse treatment, and we had the women had a special group on a day where they went and talked about trauma, and the males went and played volleyball, because it didn't occur to the administration that, well, maybe men have trauma.
How long ago was this,
Well,
Dr.
this was
Hunter?
30 years ago, so
Okay.
yeah, right, yeah, the dark ages. But what happened was that the patients started saying, well, why do they get this group and we don't? And so we started doing this group and found out that, wow, boys get sexually abused and men get sexually assaulted, and it affects them. I mean, that was the other myth, is, well, okay, so maybe it happens, but it doesn't really affect them like women. And find out that actually it does affect them, and so then I wrote a book, Abused Boys, the Neglected Victims of Sexual Abuse, and had to go to 50 different publishers, because their mentality was that, well, it doesn't happen, and if it does happen, it doesn't hurt them. And now we know that 1 in 6 males get sexually abused before he's 18. And then in 2007, I got a call from a veteran who said, you wrote that book about boys, when are you going to write a book about sexual abuse in the military? And I said, how often could that happen? I didn't get it. I didn't know. And so I started doing some investigation. I was like, oh, wow, this is way more common than
Than
one
we
would
think.
think. And of course, this was before Congress had hearings on it and things like that. And so, again, I went to 50 different publishers, and they all said, oh, it doesn't happen, and even if it does happen, it doesn't hurt them because they're tougher than regular people. And now we know that it does happen and it does hurt them. And that, trauma to me is the thing that brings most people to therapy. They're depressed. How come they're depressed? Well, because they got sexually assaulted, or they're anxious. How come? Well, because they were molested as children, or all of that. There is a biochemical nature to some of these disorders, but it's also these external factors of trauma that affect most of the people that I see. That it's a software problem. It's what's with their mind,
Right.
not what's wrong with their brain.
Exactly. In 2014, if you could sum up, what would be the overlying message to not just people who attend conferences like this, but people who are questioning these sorts of things? It's not only still out there, it's obviously rampant. What is your message to the professional for what we can do?
Well, what we can do is be comfortable talking about it, because most people still don't report what happened to them. And that I've heard all kinds of horror stories about when they finally do report it, how people say, oh, that was a long time ago, or maybe you're exaggerating it or something, instead of saying, well, of course that affected you negatively. That's normal.
Of course.
Yeah. Anyone would be damaged by that. And that, and to say, that this is good news that you were able to disclose this, and now we can work on this, that there's treatment for this, that you don't have to have this, you can end up with a scar instead of an open wound that you always have to protect.
Anything else I've forgotten?
No, that if people hear that therapy does make a difference, and that we've gotten and we know enough about trauma that we can treat that not only effectively but pretty efficiently too, and that just like the trauma affected every area of the person's life, the recovery is going to affect every area of their life too.
Thank you.
Thanks for your time.